We have a 14 French Salem Sump NG tube.
I have 60cc syringe for testing gastric juice.
We have a tone blade for pressing the tone and checking for gut reflex. Lubricating gel for the tubing and water for the patient.
We have a specimen jar for our gastric secretions, which we will be testing with litmus paper, and our normal saline, which we will be using to flush.
Before anything else, we would check our doctor's orders to see if the patient should be receiving a nasogastric tube. Then, we would explain the procedure to the patient and ensure he is seated upright in a comfortable position with his head tilted slightly back, and the bed should be at working height. We would then ask the patient to blow his nose to clear out the nasal airway. Next, in order to assess which nair is the better one to insert the tube into, we ask the patient to cover one side and blow out through the other side of his nose so that we can hear which nair is less occluded. Now we check to see which nair looks clearer so that the insertion of the tube may be as easy as possible. Now we assess the gag reflex by placing a tongue blade in the patient's mouth, touching the uvula to induce a gag response. At this point, we would also review the patient's medical history for nasal problems, i.e. nosebleeds, surgery, anticoagulation therapy, or history of aspiration. At this point, the nurse would perform hand hygiene, but our nurse is wearing gloves for the purpose of the simulation video. Now the nurse auscultates for bowel sounds, as absence of bowel sounds may indicate decreased peristalsis and an increased risk for aspiration or abdominal distension. Lastly, the nurse explains to the client that if he feels the need to gag or if he feels any discomfort, he may raise his hand to stop the procedure. Lastly, with the patient in a high Fowler's position and a pillow behind his head, we place an absorbent pad over his abdomen to absorb any secretions during the procedure. Tube length is determined by measuring the distance from the tip of the nose to the earlobe and then to the xiphoid process of the sternum. Now we place a basin on the patient's abdomen for any emesis he may have or any saliva. The nurse ensures that there are no kinks or abnormalities in the tube before inserting it. Next, the nurse lubricates the tube. Because this is a simulation video, we did not lubricate the tube. Prepare the tape by ripping off a small section and then dividing it into a Y shape at the top. This will ease the attachment of the tube to the patient's nose. Emphasize the need for the patient to mouth breathe as much as possible throughout the procedure, and then begin inserting the tube through the nostril. Once the tube has passed the nasopharynx, ask the patient to tilt his head forward and provide him with some water. Then, after every sip as the patient is swallowing, insert the tube a small amount further. This ensures that the tube goes down the esophagus instead of into the larynx. If the patient expresses signs of discomfort, stop, wait for the patient to feel comfortable again, and then continue. Never force the tube down if there is an obstruction. Once the tube has reached the measured length, tape it to the patient's nose. Use one end of the Y to go around the tube in one direction and the other to go in the other direction. This ensures maximum security. Ensure proper placement of the tube by looking into the mouth with a pen light and ensuring there are no kinks. The tube should be taped to the side of the face, out of the way, with some slack to allow for maximum movement for the patient. Use a syringe to aspirate for gastric secretions. Gastric secretions in an adult should have a pH of less than 4, and in children a pH of less than 5. This ensures proper placement of the tube. Lastly, ensure the patient is comfortable. Check the nasopharynx and oropharynx for signs of irritation and listen for lung sounds.
Clap along if you feel